From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief. I'm Renee Chou. With some local hospitals hitting capacity, there's new concern about the strain on staff. I spoke with UNC infectious disease specialist Dr. David Wohl about his experience and his hope going into the new year. So we know the U.S. is seeing record number of hospitalizations. Here in North Carolina, we're also seeing record numbers as well. How close are we getting to the point where hospitals here will have to choose who gets health care because of these increasing numbers?
Well, the good news is hospitals across the state have been preparing for surges since really the beginning of this pandemic. So I think we're not at the limits of our capacity. I think what we're at is a stretch of our capacity. And we see this especially at some of our smaller local hospitals. And these are safety net hospitals. And the safety net is just getting filled up. And medical centers like Duke, UNC, ECU, Wake Forest, we serve as a backstop to them. And so it's really hard for them when there's no room at some of the major medical centers to accept some of these more complicated patients. So I really feel for some of the smaller hospitals that are really trying their best under very difficult conditions.
And they are seeing the true toll that coronavirus is taking in our communities with those hospitalizations. You and other healthcare workers, you're on the front lines of this. I'm wondering what the morale is like among the staff, especially during these dark days of December.
You know, I think it's sort of a yin-yang. On the one hand, we're seeing case numbers go up. 1 out of 1,000 Americans has already died. We have 2,000 people a day dying from coronavirus. And so just doing the math, we know that, over the next 3 months, we might see another 200,000 people die. Yet on the other hand, there's the vaccine. And that's really exciting for people. So healthcare workers are rolling up their sleeves and getting vaccinated. I think there's hope that this could flatten the curve, as we say, and get us to a different place in another 2-3 months where maybe it's only 1,000 people dying a day and then 500 people dying a day. And then we get into the summer. So, so on the one hand, it's, exciting and hopeful. On the other hand, we're still dealing with a lot of people coming in very sick.
Dr. Wohl, you talked about the vaccine and the hope that it represents. And right now you're at UNC Hospital in Hillsborough, and behind you is a vaccine clinic. How has that been going so far, vaccinating all the healthcare workers?
I think it's gone really exceptionally well. This dropped on us rather suddenly. We had to create a system to get thousands of people vaccinated. And I think it's really good that we're vaccinating critical people who can keep those hospitals running across our state. But it also gives us practice in thinking about how to roll this out on a larger level to the community. And I think the next step is vaccinating older people, people really at risk for severe disease, people who are looking like those who are in our ICUs right now. There's a huge effort. Hundreds of people are working on this, literally, day and night. So I'm very excited. We're at the cusp of a really big change with vaccination of so many people that I do think we'll get a lot of protection out there.
Meanwhile, a lot of people traveled over the Christmas holiday, and we have another big holiday coming up with New Year's right around the corner. What's your message to folks as we head into the winter months?
I'm really proud of people who've made sacrifices, who've stayed home during Thanksgiving, who really distanced themselves, who, if they did get together, did so outdoors with mittens and hats on and scarves and really kept their distance. So I applaud those people. They're patriotic. They're thinking of other people. They're compassionate. And so for others who are making difficult decisions, just really think about this. We do have so many people who died. 1 out of 1,000 people in this country. That's just remarkable. So I think the magnitude of this pandemic really has to be front and center. There's many things we want to do, but there's some things we just can't do with a major pandemic that's killing so many people and sickening so many others.
And what we all have to remember is that our actions do matter. Every little action does matter. And Dr. Wohl, we thank you so much for your insight and your perspective. For the North Carolina Coronavirus Podcast News Brief from the Capital Broadcasting Podcast Network, I'm Renee Chou. Thanks for listening and happy holidays.